Can fertility preservation be used with IVF for cancer survivors? The question of whether fertility preservation can be used with in vitro fertilization for cancer survivors is important for many individuals facing cancer treatment. The answer is yes. Fertility preservation is a valuable option for cancer survivors, especially for those who have undergone treatments like chemotherapy, radiation, or surgery that may affect their fertility. Fertility preservation involves medical techniques to protect eggs, sperm, or embryos before starting cancer treatment. This helps improve the chances of having biological children later on. In vitro fertilization, or IVF, is a process where eggs are fertilized by sperm outside the body and then implanted into the uterus to achieve pregnancy. There are several fertility preservation options available for cancer survivors. One is egg freezing, also known as oocyte cryopreservation. Women can have their eggs collected and frozen before they begin cancer treatment. Later, these eggs can be thawed and fertilized through IVF to try for pregnancy. Another option is embryo freezing. In this case, eggs are fertilized with sperm before cancer treatment, and the resulting embryos are frozen for future use. For men, sperm banking is a common method. Men with testicular cancer or other reproductive cancers can freeze sperm before treatment for later use in IVF. Additionally, ovarian tissue freezing is an option where ovarian tissue may be surgically removed and frozen. This tissue can sometimes be reimplanted after treatment, often in combination with IVF. This approach is particularly relevant for those with testicular, cervical, and other reproductive cancers. Treatments for testicular cancer can affect sperm production, making sperm banking a standard practice. For cervical cancer, treatments may involve surgery or radiation that impacts the uterus or ovaries, making egg or embryo freezing critical. Other reproductive cancers can similarly compromise fertility, highlighting the need for preservation strategies. For cancer survivors who have preserved eggs, sperm, or embryos, IVF can be used to attempt pregnancy after treatment. Success rates for IVF may improve when using preserved eggs or embryos that were frozen at a younger age. Insurance coverage for fertility preservation and IVF can vary, but some regions have mandates that requiring coverage, which can improve access for cancer survivors. Timing is essential when it comes to fertility preservation. Ideally, these procedures should be done before starting cancer treatment to maximize success. Each person's situation is unique, so decisions about fertility preservation should consider the type of cancer, urgency of treatment, age, and reproductive goals. It is crucial for cancer survivors to consult with oncology and fertility specialists to create a personalized plan that balances cancer treatment and fertility preservation. In conclusion, fertility preservation combined with IVF offers cancer survivors a hopeful path to biological parenthood after treatment. This approach is especially relevant for those whose cancer treatments may impact their fertility. Careful planning with healthcare providers can ensure the best outcomes that align with each survivor's health and reproductive desires.